with respect to Lung Cancer Action Week, it's important to say a few things about lung cancer screening and the importance of adherence. We're now finding over 70% of the lung cancers we find in stage 1. And that's most likely a cure, for lung cancer. If you find it in stage 1, you do surgery, you take the lesion out, likely cure it, or you do very precise radiation treatment called SBRT, or stereotactic body radiation therapy. And when you bring individuals back year after year, you're going to be much less likely to find a stage 3 or a stage 4 lung cancer. If they're very adherent and compliant with their testing, you're going to probably find it in stage 1 or stage 2 if they come back every year. So your chance of curing that cancer is so much higher. Since we started our program, 64% of the lung cancers we have found have been in stage 1, but each year that gets better. This year so far, we're finding over 70% in stage 1, because these are individuals that are, many of them, coming back for repeat scanning. When we look at the scans we've done in our system presently, 80% of the scans we do are essentially repeat customers. They're individuals that are coming back for their return follow-up annual scan. We've done 50,000 lung cancer screens since we started our program in 2013. We hit that milestone on March 17th, and we celebrated that. We got our whole team together, and we met in the cancer center and got our picture taken on the stairs with big gold balloons that spelled out 50,000. And we're very happy with that, very proud of that. There's not many, if any, programs in the country that have done 50,000 lung cancer screens. And it's not just the numbers of screens that we do, it's the results that we get. We've now found over 500 stage 1 lung cancers. And I'm getting ready to reach out to that 500th stage 1 lung cancer that we found to see if they're going to be willing to be an advocate for our program, to share their story, to share their testimonials, because those are so moving and so impactful. You can talk about numbers all day, but boy, when you see a real life result of a patient that has been essentially saved by the scan, they're going to get to see their children get married, to see their grandchildren born. And that just didn't happen very often, unless you just perchance accidentally found a stage 1 lung cancer when you were looking for something else. 2 days ago, we had our first lung cancer survivor dinner and celebration, and we had over 100 lung cancer survivors and their caregivers and family members. We had staff from our team that was there. Lung cancer screening is a team sport, essentially. It takes a well-coordinated team that collaborates together and works together to get the results that we've been able to have. And we had 3 patients get up and tell their story. They each spoke for 10 minutes or so about their experience and how impressed they were with our healthcare system, the care they received. I rarely ever remember feeling so pleased to be a physician. I mean, they talked about, they thanked the physicians in the room for going through the training and learning the things we've had, and the fact that we were responsible for saving their life. And it was very moving. It literally brought me to tears, and it was impactful on many levels. And afterwards, a number of patients came up to me and said, please do this again next year. This was wonderful. And we kind of concentrated our efforts this time on patients that were stage 1 that were cured with surgery. But there's many patients that are cured with radiation treatment, with SBRT, which is stereotactic body radiation therapy. And there's many patients that are cured now with chemotherapy and radiation therapy of other kinds, and targeted therapies that are available now, immunotherapy. And there's a lot of other new lines of drugs that are coming out that are going to continue to make a tremendous difference with lung cancer survival and really work to defeat that nihilism that's associated with lung cancer, and to bring hope to patients with lung cancer. And certainly the screening brings hope to those patients at risk for lung cancer. I think it's important to continue to celebrate milestones that you achieve. It helps to motivate your staff and your associates and the team, and it also motivates the public when they see those types of success stories, and they learn about lung cancer screening and what a difference it can make. And Lung Cancer Action Week is a perfect opportunity to raise that level of awareness, to get that message out there.